ACL tears are caused by lateral rotation, backward displacement, or sideways impact of the knee while the lower leg is in a stable position. This can happen during a pivot or a jump.
Anterior cruciate ligament is one of the 4 major ligaments of the knee that connects the femur, thigh bone, to the tibia, shin bone, and helps stabilize your knee joint. Anterior cruciate ligament prevents excessive forward movement of the lower leg bone, the tibia, in relation to the thigh bone, the femur, as well as limits rotational movements of the knee. A tear of this ligament can make you feel as though your knees will not allow you to move or even hold you up. Injury most commonly occurs during sports that involve twisting or overextending your knee. An ACL can be injured in several ways. Sudden directional change, slowing down while running, landing from a jump incorrectly, direct blow to the side of your knee, such as during a football tackle. Symptoms: when you injure your ACL, you might hear a loud pop sound, and you may feel your knee buckle. Within a few hours after an ACL injury, your knee may swell due to bleeding from vessels within the torn ligament. You may notice the knee feels unstable or seems to give way, especially when trying to change direction on the knee. Diagnosis: an ACL injury can be diagnosed with a thorough physical examination of the knee and diagnostic tests such as X-rays, MRI scans, and arthroscopy. X-rays may be needed to rule out any fractures. In addition, your doctor will often perform the Lachman's test to see if the ACL is intact. During a Lachman test, knees with a torn ACL may show increased forward movement of the tibia and a soft or mushy endpoint compared to a healthy knee. Pivot shift test is another test to assess ACL tear. During the pivot shift test, if the ACL is torn, the tibia will move forward when the knee is completely straight, and as the knee bends past 30 degrees, the tibia shifts back into correct place in relation to the femur.
Procedure. Intra-articular knee injections may be performed using various approaches. During the procedure, you will be seated or will lie on your back with the affected knee flexed or extended. The skin over the injection site is sterilized and numbed with a local anesthetic. The needle is inserted into your knee joint and the medication is injected. In some cases, ultrasound imaging is used to help guide the needle to the correct site. You may feel some mild discomfort during the injection. In some cases, prior to injecting the medicine, a small amount of joint fluid is withdrawn to make space for the medication. Once the fluid is removed, the same site is used to administer the intra-articular injection. A small dressing is then applied over the injection site to complete the procedure. Post-operative care. Post-operative care will include the following instructions. Avoid strenuous activities for a couple of days. Apply ice on the injection site for comfort. Rest, elevation, and medicines are recommended to relieve pain and swelling. Gentle range of motion exercises are recommended. Risks and complications. Intra-articular knee injections are a relatively safe procedure. However, as with any procedure, there may be certain risks and complications, such as infection at the injection site, reaction at the injection site, pain or swelling at the injection site, septic arthritis, acute arthritis, inflammation of the joint lining, nerve injury. Summary. Intra-articular knee injections are a safe and effective procedure to treat pain from conditions such as osteoarthritis and rheumatoid arthritis. The procedure only takes a few minutes and can be performed in an in-office clinic setting. Though results vary from person to person, An intra-articular injection can often help you return to your regular activities and avoid surgery.
And I was able to look on a monitor and see live in the moment my ACL, needles going into my femur bone, and feel the stem cells get injected live in the moment.